Hi guys, today we'll be recording the most requested video that is on Perio staging and grading. For some reason, a lot of candidates are having a lot of doubts or rather confusion when they see a question on Perio staging and grading. And this question, one of it would definitely be asked in your ADC Part 1 exam. It's not a difficult question at all if you understand how it is done. Some people are trying to just memorize the table without understanding it. See, I'll try my best to explain in the most simplest of terms so that it's very clear in your mind and you are not in a fear of this question if it is asked. Also, understanding this table would help you to treat your own patients. It's actually a very good classification. I do understand we all have studied the basic perio textbooks in which we have studied the basic classifications as generalized chronic, gingivitis or periodontitis, or it's aggressive, or it's moderate. But this is a completely new classification which has given more clarity in the clinical terms to help the clinician. But I understand that in our schools, like of our dentistry, it wasn't taught, and right now, when a new classification has just popped up with so many stages and grades, it's really difficult to understand. So, anyways, let's go ahead and let me try my best to explain you about this. See, when a question would be asked to you, they would be asking you to give an answer which would be like example stage 1 grade A, stage 3 grade C. So you need to understand what a stage means. Whenever a patient has come to you and you're doing a periodontal examination and you have to write the diagnosis, you would first decide which stage the patient is in. Grading will come later on. So when you are going to read a question which will give you a summary of the patient's basic periodontal chart, your first aim would be to see the stage. Forget about the grade. We will come to the grade later on. If you start to answer the question by trying to classify the stage and the grade at the same time, you will definitely make a confusion and you will think it's very difficult. So let's just focus on stage and let's understand what staging means. Staging basically is based on the measurable amount of the destroyed or the damaged tissue as a result of the periodontitis. And we have to assess some specific factors that would add on to the complexity for it. So what I mean is, see, and for example, let me give you an example for you to understand in a better way. So a patient comes to you and you are now doing the probing of the gums to see how much recession has happened, and do you find a pocket, and do you find a furcation. Okay, so your first thing when you start to examine your anterior and posterior teeth, you would just see the level of recession of the gums. Now suppose you're placing a probe and you see that the gums have gone down by say 1 or 2 mm. Basically the gingival recession has happened by 1 or 2 mm. Okay, so you will write on a paper that the clinical attachment loss. I hope by this stage in your life you understand what is clinical attachment loss. It's basically the level of the gums which have recessed. Usually they are attached to the CJ, but if they have gone down, you measure it from the CJ to the level that they have gone down, to the base where your probe is going. So if it has just gone down by 1 or 2 mm, and this is generalized all over, then you would say that this is stage 1. Okay, this is the severity of the disease. I will come to the complexity later on. So this is 1 to 2 mm everywhere. Now common sense says if it's just 1 to 2 mm, you will probably not find a furcation involvement. Understandable? So do not use extra brains to think what if there is a furcation involvement. If the question is telling you the recession is just 1 to 2 mm and nothing else, straight away the option becomes stage 1. Understood? Now if you are doing the probing measurements and you find that 3 to 4 mm recession is there everywhere, then it becomes stage 2. Now in 3 to 4 mm of stage recession, you would mostly find minimum amount of bone loss, which would be horizontal. If there was a vertical bone loss, your recession level would have been more. So 3 to 4 mm will have mostly horizontal bone loss. Okay. Now, if you found the recession more than 5 mm, now when you have seen any basic tooth and if you see there is more than 5 mm of recession, that means a lot of bone loss has also happened. You would technically be on the middle third of the root. So see, you don't, why I'm saying such basic things is that you don't have to memorize this. If I say there is a 5 mm recession on any tooth, you would directly think, oh, it's reached the middle of the root. You understand? So that means the bone has also gone down by at least that much mm. Your probing depth would be somewhere around more than 5 mm, which is what is written in the complexity of the statement here, if you see where my arrow is. And there are likely chances of a vertical bone loss. Okay. Now, if you have done your carvings in your oral pathology in your third year, do you remember in a molar where the trunk of the tooth is? Trunk of the tooth is where the furcation area starts. Okay. Basically the junction where the roots start to become separate. So there is a crown and there is a 3 to 4 mm of trunk of the tooth, and then the roots start to get divided. You understand? Now if there is a 5 mm bone loss, it's a high chance that the furcation involvement is there. And that furcation involvement would either be a class 2 or a class 3. Class 2 is like cul-de-sac. Cul-de-sac means on one side you can insert the probe, but it won't come out through and through. There would be a stoppage because somewhere the interradicular bone is still there, you know, but from one end it's gone. This is most commonly in the maxillary molars. Okay, class 3 furcation is through and through, but the gums have not recessed, and class 4 furcation is actually you can see through and through. You understand? So in a stage 3, the recession is there more than 5 mm, and there is furcation involvement, but it's like stage 2 or stage 3 only. Stage 4 is again more than 5 mm of loss, but in addition to that, you have masticatory dysfunction. You must be having teeth that are very wobbly or they have drifted apart because of the disease. Like this is a very severe condition, basically the worst of all the periodontal conditions. So now if I have to come back to the staging, if there is only 1 to 2 mm of recession, it's basically nothing. It's very less. It's basically the entire gums have just gone down by 1 to 2 mm. It's stage 1. If it's 3 to 4 mm, it's a little lower, but there is no furcation involvement mentioned in the question, then you go with stage 2. But if the question says there is recession of 3 to 4 mm and there is a class 2 furcation, then you go with stage 3 because they have mentioned furcation. So basically stage 1 and stage 2, the question will not mention furcation. Simple, easy to remember. Stage 3 and 4, the question will mention that there is a furcation. And now depending on the severity of the question, you will classify it as stage 3 and stage 4. So stage 3 would be just furcation involvement, more than 5 mm of gum loss, and that's it. But if the question says the teeth have drifted apart because of the periodontal disease, or there is a class 4 furcation involvement, or there is masticatory dysfunction, that means the worst kind of periodontal problem, you will directly jump to stage 4. Is staging clear now? So if I give you a question saying that a basic periodontal examination is done and there was generalized recession of 3 to 4 mm, but there was no furcation involvement, instantly my mind will go to stage 2. I don't even have to think about it. And if I give you a question saying that there is a generalized bone recession of like 4 to 5 mm, and in one of the molars there is furcation involvement of class 2, I will read the question again because it's 4 to 5 mm. It's like not crossing 5 mm, which is like I will be like, okay, it can be stage 2 or stage 3. But the moment I say furcation involvement, I will jump to stage 3. Now I can still be confused in stage 3 and stage 4 if I'm a very like confused person. But the moment I read that it's just a class 2 furcation involvement, now I am no longer a confused candidate and I will straight away pick up stage 3. Is that clear? And if the question mentions that there is a bone loss or recession of more than 6 mm or 5 mm and multiple teeth are wobbly and they seem to have drifted due to the disease process over a number of years, blindly I will choose stage 4. Is it clear? Now, let's add on one more thing. This table also mentions that for each stage, described extent is how, if you want to add more specificity to your diagnosis and you have to write that is it localized, is it generalized, or it's molar incisor, or only molars and incisors are involved. Now localized according to this is less than 30% of the teeth involved. See, in general, we take the dentition as 32. Now, less than 30 of it is means what? If I even take 30 teeth, 30 into 30% is what? 9. So, less than 9 teeth involved means it's localized. More than 9 teeth involved means it's generalized. Simple as that. So, if the question mentions... So usually the staging grading questions would be plain options as stage and grade. It won't say localized stage 2 grade blah 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 like that. But even if it is in that way and the question says that 5 of the teeth were involved having recession of say 3 to 4 mm but no furcation involvement, what is your diagnosis? And if the options are mentioning localized stage 2, then choose that. Understood? But usually it won't be asked like this, but just in case it does, just remember, out of the total number of teeth mentioned, you multiply it by 30%. Now whatever figure you get, if the question is mentioning that figure, then you can formulate your answer. I hope this is really clear. RBL, so I'll give you short forms of this. CAL is clinical attachment loss. RBL is radiographic bone loss. In case the question is not giving you these numbers, they would give you these numbers. But this is like again easy, but 99% chance it won't be asked in the exam. Understood? Now coming to grading. Now what is grading? Grading is basically to assess what risk the patient will have with the disease progression. So if a patient comes say with just 1 to 2 mm of generalized recession, grading is basically giving you the risk factors. And now if the patient says that, doctor, I smoke more than 10 cigarettes a day. Is smoking a risk factor for periodontitis? Yes, it is. And another patient who has the same amount of recession but is a non-smoker. So in which of these two patients, after listening to their history and seeing the addition of the risk factor of smoking, do you think will recover faster, or in whom the disease is more likely to progress? Of course, that would be in the case of a smoker, right? So now, though these two patients will have the same stage, I'm not going to grade them the same. My grading is basically to let know the other clinician or my own self as the diagnosis or predicting the risk factor as more severe or less severe. So if a patient says that I'm smoking more than 10 cigarettes a day, I would call that patient as a high risk for the disease progression. And the patient who says I'm not smoking, I would grade him as a low risk for the disease progression. So when I'm going to approach a patient, by default, I'm going to grade him grade B. So grading is divided into 3 stages. Grade A, grade B, and grade C. Okay, let's come to the grading. Now let's forget about the staging for the moment. For now, let's consider that you have 2 patients and both of them have the same stage. Either stage 1, 2, 3 or 4. Doesn't matter. Let's take stage 1. Both of the patients have stage 1 and now you are supposed to grade them. Now let's see the grading. So by default, any patient comes to you, you will rate him as grade B. Okay, you're going to assume that he is a smoker and he has diabetes. Now depending on what the patient says, I'm either going to classify him into grade B itself, or I'm going to lower his classification as to low risk, that is grade A, or I will elevate him in my classification system, put him in grade C if he's giving me more further complex history. Now what is grade B? Let's just remember grade B first. Grade B, I know this is a big table, but I do not want you to remember the first 3 things. Forget it. I want you to remember the last 2 ones. That is cigarettes and diabetes. Grade B, you have to memorize this, okay? Grade B is less than 10 cigarettes per day. And hemoglobin is less than 7%. Understood? That's grade B. So by default, I'm going to classify even without looking or asking the history that the patient is having whatever stage and he is a grade B. Now I will ask the patient, do you smoke? He says no. Okay. Do you have diabetes? He says no. I move in to grade A. So whatever stage I have decided after examination, I'm going to write grade A, which means that whatever stage he has, but he has a low risk for the progression of that stage. Understood? Simple, clear. Now I move on to grade B. The patient says I do have cigarettes, but they are less than 10 and I have my blood sugar in the range of less than 7. Less than 7 is considered normal. So, or a controlled diabetes. You know, it has to be less than 7. It can be either be normal patient or a controlled diabetic patient. Mark my words, I'm saying controlled diabetes. Controlled diabetes is as good as no diabetes. So that would be grade B. If the patient says I'm having more than 10 cigarettes a day and my diabetes is uncontrolled or it's more than 7, I classify him into grade C. That means his disease will progress at a faster rate. You understand? So now let me give you a question. There is generalized recession of 1 to 2 mm and the patient says that I am a heavy smoker. I consume 20 cigarettes a day and I have diabetes and it's more than 7. So 1 to 2 mm recession is stage 1. But because he says he has more than 20 cigarettes a day and his diabetes is more than 7, he becomes grade C, meaning he has recession of 1 to 2 mm and he is at a very high risk of the progression of disease. Hence, grade C. Now, if the question says that the patient is having a recession all over of like more than 5 mm and there is furcation involvement of class 2 type, but the patient is a non-smoker and the patient does not have any diabetes. So what does the classification become? It's stage 3 because it's more than 5 mm. But there is furcation involvement of only class 2 and there is no other problem. So hence it becomes stage 3 like we learned in the previous chart. And what grade it is? Because he's a non-smoker and non-diabetic, he has a low rate of progression of this disease. Now I understand in ADC a question will come like this, that the patient had severe bone loss in 5 of his teeth out of 30 teeth and he is having clinical attachment loss of 5 mm, and he has 5 wobbly teeth because of this disease, and he's a smoker of less than 10 cigarettes, and he does not have diabetes. Now, because this is your first question and it mentions that 5 teeth have become wobbly because of the disease progression, that means there is severe bone loss. I will directly jump on to stage 4. But he has cigarettes less than 10 and he is non-diabetic. So my grade would be grade B. Now the second sub question would be, you extracted those 5 wobbly teeth. And now the clinical attachment loss is 5 mm all over. What is your classification now? Very good question and very simple question. Now, when a second question is asked like this, the grade has not changed because he's still having 10 cigarettes a day, less than that, and he's still not having diabetes. So my grade B would still remain the same. You understand? So there is no confusion in grading because my risk factors have not changed at all. What will change is my stage. Because earlier there were 5 wobbly teeth because of the periodontal disease. Now since you have removed that, now it's a generalized recession of 5 mm and the question is not mentioned any furcation involvement. So I will move my stage from 4 to 3 and now it becomes stage 3, but my grade will remain the same, that is grade B. Now if the third sub question said the patient has 5 mm of loss, the same patient came to you after 6 months and he still has 5 mm of recession all over, but there is no furcation involvement and the patient has stopped smoking since the past 4 months and he is not having diabetes. Now what is your classification? The stage of having recession more than 5 mm but no furcation involvement and no more wobbly teeth. So I go to stage 3. My stage has remained the same like my previous sub question. But what has changed? My risk factor has changed. There is no more smoking involved. So I will move my risk of this patient for the progression of disease from grade B to grade A. Or if the question said the patient started smoking more than 10 cigarettes, then I would have moved it to grade C. If the question says he's having more than 10 cigarettes and he's a normal diabetic person, as in he's not having diabetes, still my stage grade would be, I'm sorry, it would be grade, not stage. Still my grade would be grade C because he's having more than 10 cigarettes. So to come on the right grade, you need to have both these factors. More than 10 cigarettes and more than 7 of glucose is grade C. No cigarettes but still uncontrolled diabetes is grade C. You understanding? So both the factors have to be satisfied. So I hope like this is very, very clear now and you will no longer ever have a problem in understanding the question and solving it. I have given you multiple examinations while I was speaking. If you feel you need to listen to this video again, please go ahead, listen to it 2 times, 3 times. Understand what I'm trying to say slowly. Grades are just the risk factors. Stage depends on how much recession and the furcation and the wobbliness of the teeth is there. That's it. Extremely simple classification to understand, to remember, and you can answer thousands of questions based on this classification once you understand it. If you have understood this, let me know in your comments or you can WhatsApp me. And if you want me to shoot more videos on certain other topics that is confusing you, just again leave it on my YouTube comment or WhatsApp me. I hope this is very clear and I hope this video was really helpful. Thank you.